So let's start with a little bit of an overview about prostate cancer in general. And prostate cancer is, one of the most common cancers in men. On average, all men have about anywhere from 11 to a 14% lifetime chance of developing prostate cancer. Typically, the average age of onset is 66 years. You can see it younger, you can see it older, but again, the average age is about 66. And there are certain risk factors that are well defined that can increase the risk of developing prostate cancer. So age is really a risk factor for everything. As we get older, our chance of developing all different types of conditions goes up. For reasons potentially related to genetics, there does seem to be a higher risk of prostate cancer in African American men compared to men of Caucasian or Asian descent. Hormones, so really kind of how much androgen or estrogen your body's naturally making. If a man has an exposure to these hormones for other reasons, that can increase the risk. A few things that aren't really clear are things like diet, whether people who may have an elevated body mass index, who would be considered obese, may be at a higher risk, smoking and chemical exposures. But one of the most important risk factors aside from age is family history. And it is known that prostate cancer is a highly heritable cancer, meaning if somebody in your family has prostate cancer, your chance of developing it is going to be a little bit higher than average. And that risk really does depend upon, let's say, who in your family has had it, or at what age they were diagnosed with prostate cancer. So this table on the left side of your screen is presenting the risk of prostate cancer in terms of a relative risk. And a relative risk means essentially, what is the chance of developing cancer somewhat compared to the general population. So for instance, if a man has a brother who's had prostate cancer, his chance of getting it is going to be about 3 times higher than a man who does not have a brother with prostate cancer. You can see the risk is a little bit lower for a father, but if you just kind of take any first-degree relative, again, a first-degree relative would be a brother, a father, or a son, there's about a 2.5 times increase in risk. The risk is slightly higher if one of your family members is diagnosed under the age of 65 rather than after the age of 65. Even if you have 2 second-degree relatives, like an uncle and a grandfather, or 2 uncles, the chance of getting prostate cancer is going to be a little bit higher than average. And really, the more relatives that you have diagnosed, the higher the chance is going to be. So again, if you have, let's say, 2 brothers or a brother and a father, there's nearly a 5 times the chance that prostate cancer would develop in yourself if you have that type of family history. And so it's really probably a combination of multiple genetic factors, so different genes that are maybe slightly increasing the risk. And it can be also attributed to shared maybe environmental exposures, maybe where the family grew up, different things that they may have been exposed to, different lifestyle habits, or maybe even different cultural exposures that a family would share that would allow for an increase in risk. And when you think about what's called a multifactorial risk, when you factor in genetics and family history and lifestyle and environmental exposures, the more exposures you have, the higher the likelihood of getting prostate cancer is going to be. And that's really supposed to be represented by these 2 jars here, where you can see the jar on the left, the individual has several different risk factors in terms of maybe family members who are affected and other genetic factors. Whereas the jar on the right, you can see it's really overflowing with risk factors supposed to represent really a much higher chance of developing prostate cancer than average. The American Cancer Society is a cancer advocacy group that really has come out with a number of different cancer screening recommendations for lots of different cancer types. And so the American Cancer Society for prostate cancer does recommend screening for this type of cancer. The first thing that they really want to make sure people are doing is discussing the risk of prostate cancer with their healthcare providers to get a better sense of what the risk is, to figure out what type of screening should be done and also when screening should start. So for instance, a man with really no family history of prostate cancer, no clear obvious risk factors, the typical age that you want to start screening is around age 50. But if someone is of African American descent with no family history, or if a gentleman has a father or brother who had prostate cancer under the age of 65, you'd actually want to start screening about 5 years earlier at age 45. And then for men who have maybe more than one first degree relative, so again, two brothers or a father and a brother that all have prostate cancer, you'd want to start even earlier than that. So at age 40 is when you'd start screening for prostate cancer. And there's two main tests that are typically done for prostate cancer screening. One is a blood test that is called the prostate specific antigen test, or PSA. And that is basically looking for a protein that is produced by the prostate in the bloodstream. And often, but not always, it can be an indicator of potential prostate cancer development when there's an elevation in that PSA number. And the other way to screen for prostate cancer is through a digital rectal exam. This is an exam where a physician is able to feel the prostate through the rectum. And these are the two main screening modalities for prostate cancer. And the recommendations continuously are evolving for individuals who may actually have a hereditary risk of prostate cancer, which we'll talk about shortly. If, let's say, somebody has a PSA test that's abnormal, or a doctor does a digital rectal exam and the prostate feels really firm, it may call for the doctor to do a biopsy of the prostate to see if a prostate cancer is present. And typically what will happen is a needle will be inserted into the prostate to collect tissue to be able to look at the cells under the microscope to see if there's a cancer that may be present. And the reason for doing this, aside from just making the diagnosis, is really getting a sense of how aggressive does the prostate cancer look, and that information can guide the appropriate treatment options. And the main ways that prostate cancers are scored in terms of, let's say, its aggressiveness is by something called the Gleason score. And the Gleason score is a way to look at the cancer cells in a biopsy, and compared to the normal tissue, how much of the biopsied tissue has cancer cells in it. So when there's few cancer cells, it may be given a score of 1, where when there's multiple or lots of cancer in a biopsy specimen, they may give a score of 5. And so when they do biopsies, they typically take 10 or 12 different biopsies of the prostate. So the pathologist who's looking at the cancer cells will basically look at the 2 biopsy specimens that have the most amount of cancer in it and will develop a score. So from the piece of biopsy that has the most amounts of cancer, plus the piece of biopsy that has the second most amount of cancer. And so when you add up these scores, you typically have anywhere from a 6 to a 10, with prostate cancers having a Gleason score of 6 being less aggressive, to Gleason scores having prostate cancers having a Gleason score of 10 being very aggressive types of prostate cancers. So in addition to doing a Gleason score, they will also, once the prostate is potentially removed for treatment, they'll look at the size of the tumor, they'll look to see if the cancer has spread to nearby lymph nodes, they'll look at PSA levels to ultimately determine what the stage of the prostate cancer is to, again, better guide treatment for those individuals.